I've created a model to predict how the pandemic is going to progress in Australia. Currently, the growth rate in Australia is that we are doubling every 3.5 days. You can take the number of cases today, multiply it by 1.21, and you can use that to predict the number of cases tomorrow. At this rate, our health system is unlikely to be able to keep up with the demand from the 13th of April to the 23rd of April. That's when it's likely to start having problems, and they will not have the ability to treat patients again until sometime between the 20th of May and the 31st of May. If everything goes according to this model, the majority of infections would be over by the middle of June. If Australia is able to flatten the curve, reduce the rate to a point where we are not going to overstretch our health system, we will need to get our cases to double every 13 days or even a longer period of that, which corresponds to taking today's cases and multiplying it by 1.05 to get tomorrow's cases. Anything more than that and our health system will not be able to keep up with the number of cases. If we manage to achieve this, our health system will be under huge demand between June and October, and it will be December before the majority of cases are over. I'm now going to explain how I worked out all of these dates. All I did is I fitted a sigmoid, which is an exponential at the beginning and it flattens out after a particular time. The circles you could see on the graph there, they are the real data points which I took from Wikipedia. The curve is the curve fit. I fitted this curve using least squares regression, but you could also get a reasonably good idea of how it's going to behave by taking the log of today's cases minus the log of yesterday's cases and then dividing by the difference in the days, which would just be 1. I have also assumed that 20% of the population will get sick, and that's a very conservative guess based upon newspaper articles. If this goes to the point that we are relying upon people's immunity to prevent the spread, we really do need to go up to about 75% of the population getting sick, which makes everything much worse and will extend out the amount of time it will take before things go back to normal. Using that curve fit in that model to work out the number of people which don't know they're sick but are currently spreading the disease, what I've done is I've got the original curve fit and then I am subtracting off the same curve fit with an offset of just 3 days. So I'm assuming that the time between when you get sick and when you know about it and you're in a position where you can affect others is no more than 3 days. To work out the number of people that will be sick at any particular time, I've done the exact same things I worked out for the number of people which could potentially be infecting others, but instead of just doing it for 3 days, I've done it for 18 days, which is about 2.5 weeks, which is how long the sickness generally lasts for. If we look at the number of people which will need hospitalization out of those people that get sick, current estimates are about 20% of people who get sick will need to be hospitalized, and I've also assumed that it will not be quite as long of a period. So even though the sickness lasts for 18 days, I've assumed you'll only need to be in hospital for 7 days. The horizontal line is the current number of hospital beds in Australia. The blue line shows the number of people which will need to be taken into hospital. And everything that is above that line will be people which really need to go for the sake of keeping them alive, but will be unable to go to hospital. This is what I have defined as our health system not being able to keep up with demand. The dates, which I have said before, are based upon the intersection of the number of hospital beds and the number of people which require hospitalisation. It's predicted that of the people which gets hospitalised, that 0.16 of those people, or 16% of those people, would need intensive care. There's only around 2,000 intensive care beds in the country, and we will easily exceed that, and the people which become sick in this period above this line are likely not to be able to get the intensive care they need to stay alive, so are very likely to die. Again, I've assumed that the intensive care time would be 7 days. If we intend to flatten the curve, we need to get the rate of infection down so it only doubles every 13 days rather than doubling every 3.5 days as it currently is. The consequences of doing that is that everyone who needs to go to hospital will be able to go to hospital. There's still going to be issues with intensive care. If we can achieve that, we move it from the blue line across to the yellow line. The yellow line, however, extends the amount of time that we're going to be needing to worry about quarantine measures, which means that we're going to have to continue with what we're doing, or even stronger measures, quite likely all the way through until December. There is yet another option. If we take incredibly extreme measures to the point of really no one interacting with anyone, we could potentially eradicate the disease from the country, and that will only take around about a month to achieve, but the quarantine measures that they'll need to put us under are much more extreme than what they currently are. In many ways, it would be nicer if we could just spend 1 month being under severe quarantine rather than pretty much the entire year, which is looking likely as to what's going to be happening. If we did take that option of completely locking ourselves down, we would still have to keep international travel locked out of the country to prevent it from coming back. Let's look at our individual choices. So what I've done here is I've calculated our individual probability of contracting the disease, assuming we're only going to get infected from those people which don't know they're sick in that 3-day time period, and I've based it on the number of people that we interact with each day. If we personally interact with nobody, we're not going to get sick. If we interact with only one person each day, and that one person doesn't include someone that's in your house, that doesn't go out and is just spending time with you, it's only external people or different people. And you're looking at, if only one person, about 45 to 50% chance of you getting sick. If you go to 2 people per day, looking at 60 to 70%. 3 people, you're up to 80. 4 people, 90. 5 people, 95. And as you get even more than that, it pretty much goes up to you're guaranteed to get sick. How I worked this out is I worked out the probability of you getting sick on a particular day, which just comes from the curve fit of only 3 days for people not knowing they're sick that could still infect you, divided by the population of the country. After I've got that probability, I then use what's known as an urn model, where it's like I have an urn filled with balls, and I draw from that urn one at a time and then look at my result. And that represents like going out and interacting with another person that could potentially get you sick. You don't know, and they don't know that they're sick or will give it to you, so it can be somewhat seen as though it's just going to be random on whether or not that particular person is sick and whether or not they'll give it to you. After I've got that probability, I then form up a tree diagram where I've got all of my possibilities, just like a coin flip. So I've got on one side the probability of not getting sick, and on the other side the probability of getting sick. To calculate the probability of you not getting sick, the first person you interact with is just the probability read directly from probability distribution of not getting sick. The next person that you see is like drawing a second time, which means that you multiply your probability of not getting sick the first time times your probability of not getting sick the second time. And you do that for every interaction that you're going to have with any person. After you've got down to your final result, you'll have the probability of not getting sick. And what I've plotted here is 1 minus the probability of not getting sick, which is your probability of getting sick based upon the number of people that you interact with. This also gives us an idea if we only want 20% of the population to get sick, we would need to, every single one of us, interact with less than one person per day.